We go. All right. Good evening, everyone. Um, Welcome to our training for the Speakers Bureau. We are going to hopefully keep you no more than an hour. Very quickly, let me go through our order for the evening. Okay. That is not what I meant to put up. Kathy's going to do that. Let's see, maybe I forgot to put it up. Yeah, I forgot. That's okay. So the first, we're going to have a brief welcome and introductions, and then I will find the proper slide to put up for the order of our presentations tonight. So I'm Dr. Linda Clark. I serve as the Chief Medical Officer here at Common Ground Health, and I'm accompanied by Sue Nudd, who is our coordinator for this whole project. I'm accompanied by analyst Kathy Lynch, and she can tell her exact title. I just know she's really smart and she knows what to do with numbers and graphs. She will be working with us tonight to do a sample presentation. I have Jackie Dozier, who's driving safely, and she's the program manager for, what is it, Jackie? Community engagement and well-being. I probably gave her a different title. And
community health and well-being.
I was close. I was close. And I have Amy. I think she's still here. Amy is our communications specialist. I think that's our team for this evening. So the first thing I'm trying to remember is the purpose of our Speakers Bureau. Jackie, can you speak on that as you're driving, or do you need somebody else to do that?
No, I've pulled over so that I'm not trying to speak and drive.
Thank you.
So good evening, everyone. I want to talk a little bit about our Speakers Bureau. As most, if not all, of us know that there's a lot of miscommunication being spread about COVID-19 and the vaccine. And here at Common Ground Health, we want to make sure that people are getting correct information so that people can make their own decisions, especially about taking the vaccine, and be able to articulate why they are not taking the vaccine. So the COVID-19 Speakers Bureau provides the most recent up-to-date information to groups and organizations throughout the Finger Lakes region, and it's free. I'll say that again, it's free. Speakers can address groups virtually or in person. And of course, if they're in person, we'll still need to follow, masking and social distancing guidelines. And these also are available we also have bilingual speakers. We have a group of trusted physicians, pharmacists, community workers, community health educators, researchers, and other non-medical and medical professionals who can adjust a formal presentation or who can provide informal chats, which we call table talk discussions, to a wide range of audiences. Most of the topics include how the vaccine was developed, myths around both COVID-19 and the vaccine, the disparities in distribution and COVID-19 symptoms, which also within the presentation allows time for question and answers. So I think, did I miss anything?
No, I don't think so, but you did talk about the range of presentations that are requested. It could be anything from 5 people in a very informal setting, or even less, or as many as 250. So,
yeah.
Cool. Thank you.
And to request a speaker or to apply to become a volunteer to be a speaker, you can go to our website at www.commongroundhealth.org/speakers. Thank you.
Thank you for reminding me that. And I also, would you please put your name in the chat just so we can keep track of everybody who's with us this evening. And maybe Amy could just type in the, since she's the fastest typist, if she could type in the address for the Speakers Bureau. So most of you guys have already signed up. For people who have not, they can go to that website that Amy's going to put on. But people, like Jackie said, who are requesting a speaker also go to that same website, and you'll see two different buttons that you can use, one to become a volunteer, one to request a speaker. And that's also where you'll find our information for you, like our slide deck. So I'm going to give this over to Sue at this point, and she's going to talk a little bit about how we match speakers to requests.
Yeah, hello everyone. The matching process begins at a weekly meeting. We assess the requests that came in during the week. We look at the type of organization making the request, the audience they're trying to reach, the type of education they're looking for, the presentation type, and at what date and time the speaker is needed. From there, we turn to our speaker volunteer list to see who's available at the requested time and who may have a specific expertise requested. Whenever possible, we try to schedule both a clinician as well as a community health educator to each engagement. We ask that you work out the presentation details between the two of you. The most difficult part of the process is the turnaround time to match the speaker to the engagement. We usually have a 2-week turnaround to start that matching process. During that time, you'll receive an email from me checking your availability. Once I have a speaker lined up or speakers, I'll notify you of any changes or updates and send you a calendar invitation with details such as Zoom information. I ask that you please respond to my emails so that if you're unavailable, I can reach out to another speaker. And I do that because of that short turnaround time, and it allows you as the volunteer to have enough time to prepare a presentation. I may also send you a text as a reminder to check your email. So if you see the name Sue Nudd, it's me just sending you a gentle reminder. And that's about it. Anything else you can think of, Dr. Clark?
No, right now we don't have a formal evaluation process. Actually, we do, excuse me. We have a formal evaluation process that we send out, and we are happy to give feedback about presentations to you as we get feedback from people who have viewed our presentations. So we think that will be positive and helpful. And certainly feedback for us, if you have something informally you want to talk to us about, feel free to send us an email, and I'll ask Sue to put that email in the chat, but it's just speakers@commongroundhealth.org. Okay, so now the lady of the hour, Amy. Amy Nudd, Amy Knapp is going to talk to us a bit about the all-important deck, the slide deck that she has taken a lot of energy developing and, most importantly, keeping up to date. You're on mute, Amy.
That is a very big task because, as you all know, things with the vaccine are changing day by day. So I'm going to request to share my screen. Okay. And when you, hang on one second, this is displaying in a way that I wasn't expecting. Okay. Okay. When you download the deck from our website, and that is the place where you'll find the latest deck. So right before you are going to be doing a talk, we suggest that you download the latest version of the deck. For instance, I've been working on version 3 of this deck, and then new news came out about the Johnson & Johnson vaccine, sparking some additional slides that I'm working on adding. So the deck is a constantly changing and evolving thing. So that's why it's easiest to just go to the website, and once we've got everything vetted, then we put it up there. Find it there. And also, by the way, thank you all so much for volunteering to do this. This has been a really important way to get information out into lots of areas of the community and try and reach as many people as possible with accurate information to help counter some of the misinformation that's out there. I'll try to share again. So when you download the deck from our website, you're going to see it looking like this. This is in slide sorter mode. So in PowerPoint, if you hit the view button here, then you find slide sorter. And this is a way that you can quickly see all of the slides that are out there. As you'll see, this is a very long deck. It's got more than 150 slides in it. That's intentional. We don't expect you to use all of these slides. We are trying to provide you with as much information as we can so that you can tailor your presentation to your audience. So feel free to download the deck and then delete slides. That's what we intend. I'll show you that a few of the slides have some special capabilities to them. So I'll demonstrate those in a minute or two. But just feel free to take the deck and make it your own and tailor it to the audience that you're going to be presenting to. When you're inside sorter, go over to the normal button, and that'll take you to the view where you're most accustomed to. And then at the very beginning of the deck, it's there's an instructions page, and it aligns the structure of the deck and explains a few of the special features that I'll show you. The deck is structured into 7 topics, and then they have subtopics, and the slides are organized into sections. You can actually hide a section, or you can delete a whole section. Over here, this is the instructions section. So if I hit the instructions button, it highlights the whole instruction section. If we intend for you to add and delete slides, and we have agenda slides scattered throughout, but if you delete a section, you may need an agenda, a new agenda. So we included a blank one here in case you change the deck and you just use a few slides, you might need just a very short agenda. So that's why we added that here. Feel free to customize that. And then we also have a slide here telling you what version the deck is on so that you know whether you've got the latest one or not. This is version 2.0. I'm working on 3.0 and pretty close, so that should be going out very soon and will be put on our website. The deck, we are trying to brand the deck to match with a communications campaign that we're working on rolling out that's in concert with a national communications campaign around vaccine confidence. And the name of that campaign is It's Up to You. So that's why we've rebranded the deck in a new version to make it say It's Up to You. We may also be changing the colors of the deck and general branding of the deck. So be watching for that. If you start seeing a lot of yellow, that's not a problem. That means that we've started making those branding changes to the deck. I'm going to show you a few slides, but I'm going to hop into the presentation mode to do so. Oh, I should show you the videos. It would be helpful for you to flip through the slides and practice your presentation before giving it. All of the slides have animation, so it's just helpful to know how many times you have to click for a slide. It looks blurry, but then it'll pop up and be not blurry. These are a few videos. They're somewhat long for a formal presentation, but they might be helpful if you're doing something informally. They're about 5 minutes long, so that's long to make an audience sit through. But there's some cute ones. There's a Schoolhouse Rock one that talks about how vaccines work. So feel free to incorporate those. If you use a video slide, make sure you have very stable internet, that the Wi-Fi is not going to cut out on you in the middle of the presentation. We also have down here a little link that if it doesn't work in the slide, you can always click on this link and hop over to YouTube and play it from YouTube. I'm going to escape and take you further into the deck to show you those special features slides. We talk about side effects, we talk about safety, and we do talk about the speed of the vaccine. In that language, we talk about how scientists had a head start, which is why they were able to develop the vaccine so quickly. And then we do have some clinical slides here with data about the clinical trials, so that if you're talking more to a clinical audience, that might be a great slide to include there to take them into the background of the vaccine. Then we talk about some of the efforts in the community around equitable distribution. We have some sections specific to audiences. For example, we have some slides for Blacks and Latinos. If you think that that's going to be a predominantly Black and Latino audience, you might want to include slides from that section. And for example, this is Kizzmekia Corbett, who led the work on the Moderna vaccine. And if you see that the slide, for example, we don't have a lot of slides around the Indigenous population. I'm working on adding some more to that. But if there are some slides or questions that you think would be helpful to speak to Indigenous population concerns or senior concerns or concerns of migrants, that's something we can absolutely add. Just please send me an email and we'll talk about what we could add to the slide deck. Then we have a section called Good Questions About Vaccination, and I'll hop into presentation mode for this. This is some common questions that people have brought up about the vaccine and about variants. So if you click next, it'll take you to the very first question slide in this section. And if you click again, it'll take you to the answer. So the question is on the left, the answer is on the right. But unique to this deck, if you click back in the white part on the left side of this slide, it'll take you back to the questions. So you could somebody could ask, can I get 2 different shots? Can I get the Moderna first and Pfizer second? You can click to that and it'll take you directly to that slide. And then there's a couple clicks here to get the full answer. And then you can hop back by clicking on the left to the question slide and hop to a different one. If you click on the right-hand side of the slide, it's going to take you to the next question. And if you're like, okay, I'm done with question and answer, I want to get out of here, click on the left and then go to the last question. If I get vaccinated, why do I still need a mask? And then you just click through this and you can click off it. Then the next section of slides, it's a similar format. It doesn't jump back and forth like the question and answers do, but this is questions about what specific religions say, and this is not all inclusive. I just picked a few for ones that I thought would be helpful. I can always add to this if you're doing a presentation to a church, a temple, some other sort of religious gathering, we can add slides in here and get information. And this can help spark, in general, religions are universally positive about vaccinations and they are very supportive. So we want to get that message out there. There may be some nuances to specific organizations or religions or denominations that we can include, but we want to make sure that we can answer those. So feel free, we're not expecting you to use all of them. If you're speaking to a group and you want to use one of them, that's totally fine. And just send me an email if you need a specific slide for a group that's not covered. The deck continues to emphasize that it's important to wear a mask, stay apart, wash your hands, and stay home when sick, even after vaccination. So you'll be seeing a sample presentation later tonight, and that'll help you see how you can go through a bunch of slides in not a lot of time, but you don't have to use all of the slides. Are there any questions about the deck or how to use it?
Amy, when I got the invite for the meeting, I linked to the site and looked
Mhm.
at the slides. I think they're just terrific. I was really impressed. They're
Thank you.
they're beautifully done. They're very informative, and I think it's a great help to create some consistency for all of us in the Speakers Bureau.
Mhm.
But beyond that, it's just a real great public service. So thanks so much.
Thank you. And again, it's constantly evolving. So keep watching for the latest update, because there's been a lot of big news and a lot of questions will be coming out about the pause for the Johnson & Johnson vaccine. So we are addressing that in the next version of the deck, and I hope to have that out very soon, helping people understand their risk with the vaccine and their risk with COVID. Okay.
Amy, can I ask you, I know we literally are just finding out information yesterday and today about J&J, but any thoughts on when you might have those slides together? I think there's going to be enormous amount of questions about that.
Yes.
in the coming days.
I'm hoping by the end of this week.
That'd be great. That's awesome. Thank you, guys.
Thank you.
Amy has a lot to do. We've been talking about communications with our COVID response. So we're very appreciative of the work that she does. And just to let you know, she also vets information so that, you know, she might run it by one of us, you know, one of our medical people or whatnot. We have our research and analytic groups and make sure our data is right, so that we can make sure you have really accurate information when you're going out into the public. So before we get to our sample presentation, and we're hoping people can stick around, I know some of you cannot, but we're gonna go through an actual presentation, and there'll be an opportunity to ask some COVID questions at the end, but then some general questions about this whole process in case we missed anything. There is a video on our website that gives some guidelines for presenters, but I'll just quickly talk about a few of them. Because today I did my usual thing. I wear a really very loud piece of clothing because I like prints. I don't like solids necessarily. But it's very helpful if when you're presenting to not have a distracting background, clothing, jewelry, etc., just so that people have their mind on the presentation and not you. I always have water nearby because it's easy to get a dry mouth, especially if you wear a mask half the day. I would, and in terms of the backgrounds, just I'm looking at my area is a little messier than I like, but have a background that's looking professional when you go, and certainly use a background if you've got kids, right? The potential to run around behind you. I always try to call in a little early. As Amy mentioned, you want to check your internet connection. If it's kind of shaky, you may not want to use some of those videos, for instance. I tend to not use the videos in our presentations because people really want questions and answers. So I would say really choose your slides carefully so that you have plenty of time for Q&A. What else? Check your Zoom settings. I think we're all probably pretty Zoom savvy at this point. But every now and then I'll do something like use my headphones and then forget, and I'm not able to be heard, with my audio settings. So that's another reason to just log in early to make sure that everything is set. The other thing is the fidelity of our deck. It is very beautifully done. And we want to make sure that our information is consistent, but we might miss things. So if there's things that you think need to be added, please just send it to our speaker's email, and we can make sure Amy gets it, that we vet it, look up any information just to verify. But you may find, like I sent an email to Amy the other day saying, we could use another slide or two on women's health issues. So we're constantly improving the deck, but we're asked that you don't improve it on the fly. So we really want it to stay intact, not to stick in, extra slides without vetting it, because we want to make sure that everything that comes out under this hub and Common Ground Health partnership is indeed accurate and consistent. So at this, I'm gonna just stop and I'm gonna ask Kathy, am I putting up the slideshow or are you putting it up?
Yep. Can I ask a question?
Yes, Dr. Beckman.
Sorry, I was still muted.
Yes,
One
no.
thing as you're presenting is that you won't be able to see the chat, any questions going into the chat. So I don't know if you would want to have me presenting and then you would be able to see the chat, and that's something else you can determine with your partner.
Exactly. Thank you for mentioning that. And traditionally, a lot of times we match a clinical person either with another clinical person or with a non-clinical person. So at least one person has a clinical background. And the partnerships vary. I traditionally, when I serve as the clinical person, I usually let the other person do the presentation. Then I can answer any questions in the chat that might come up, and then help do the Q&A at the end. So that's the model we're going to use today. Kathy's going to present. I'll man the chat, but you work that out on your own. And I think Dr. Beckman, you had a question.
Yeah, I've spent a lot of time learning how not to run a Zoom meeting. So is there someone that can be helpful putting up the slides, following the chats, keeping track of what's going on for some of the clinical people that might not be experts in doing the Zooming?
Yeah, so I saw that question in the chat, and so that's something that your partner might do with you. Let's say you're presenting with Kathy, and she might man the chat. She may, if you need her to advance the slides and do that, so you can work it out with your partner. The other thing, especially if you're presenting by yourself, every now and then, I might present by myself. We can send your slides to the host. So the host can help you in that regard in terms of advancing slides and helping to monitor the chat. Okay, so it's about 5:30. I mean, excuse me, I wish it was 5:30, 6:30. We're gonna see if Kathy can do this in 10 or 15 minutes, and that'll leave some time for questions at the end. Not to put her, not to have a race, but.
Can you all see my slides?
Yes, ma'am.
And I can't get it to go into presentation mode. There we go.
Twice. No, that's not it.
No, what do you see? Are you seeing the slides or the notes?
I'm seeing preview, and we will see the notes. You're in a different mode.
Right.
Here, let me put mine up right quick, and
Okay.
I'll advance for you. That's what I kept trying to put up before. Let's see.
Okay.
Could everybody mute, please, just for recording purposes, except Kathy?
All right, so I'll go ahead and start. Good evening, everyone. My name is Kathy Lynch. I'm a health planning research analyst at Common Ground Health. And this evening, I'm just going to walk you through COVID-19 vaccines and you. Next slide, please. So I'm just going to briefly talk about what is COVID, talk about the vaccines and how they were developed, take a look at some of the reasons why you might want to take the vaccine, and then look at some of the work that's underway to ensure equitable distribution of the vaccines. So let's start with what is COVID. A coronavirus, it's a virus that's similar to the influenza virus, but it's a totally different ball game when you're talking about coronavirus. The SARS outbreak, if some of you recall that SARS outbreak from about 20 years ago, that was a coronavirus. And about 10 years after that one, with the MERS outbreak, that was also a coronavirus. So coronaviruses aren't new per se, they've been around for a while. Next slide, please. But what we have is a new coronavirus that was discovered in 2019, hence the name COVID-19. Next slide, please. So symptoms of COVID-19, there's a plethora of them, including fever, trouble breathing, loss of taste or smell, sore throat, chills, slew of different symptoms of COVID-19. Next slide, please. And one of the things about COVID is that even if you have no symptoms, you can still spread it to other people. So then these other people get the COVID and then spread it to others. So it's important that everyone needs to take care to not spread COVID. And how do you go about doing that? First off, wear a mask over your nose and your mouth. You want to cover both. You want to physically distance of 6 feet or more, stay apart. Wash your hands often and thoroughly, and stay home if you're feeling ill. If you don't feel well, stay home. Next slide, please. So let's talk about how the vaccine was developed. As I mentioned, SARS is a coronavirus, MERS is a coronavirus, and those things were around 10 and 20 years ago, and work started on vaccines for the coronaviruses at that time. So when the COVID-19 hit, vaccine research had already been underway, and it goes through some phases, starting with phase 1, with a very small population or small pool of volunteers who get this new vaccine, and researchers want to answer 3 questions. First, is the vaccine safe? Does it work? Are there any serious side effects? So does a vaccine actually produce any antibodies? In phase 2, we look at several hundred volunteers who receive the vaccine. And researchers here are looking for, the most common short-term side effects, whether the vaccine is producing the correct immune response, and is the vaccine protective? So not only is your body making the right vaccine, or antibodies, I'm sorry, but is it making it the level that's protective and required to really prevent you from getting sick? The third phase is where thousands of volunteers get the vax. And in this phase is when researchers are trying to determine how do disease rates compare in the 2 groups within their study. So you've got one group of people who don't get the vaccine and another group of people who do get the vaccine. And then researchers look at whether or not each group is getting the disease, whether the population that got the vaccine is protected with the antibody that their bodies are producing, and then what's the level of protection that they can expect to get from receiving the vaccine. So once those questions are answered, the vaccines typically then go into phase 4. This is where the FDA fully approves the vaccine and determine that it is safe, it's efficacious, and its benefits outweigh the risks of getting the vaccine. So the research studies generally continue a number of years beyond that approval. They can go out another 1 or 2 years as researchers look for any long-term effects of the vaccine. So it's a lengthy process. It seems like it was faster with this because, as I said, the work on these particular coronavirus vaccines started years ago, decades ago. So next slide, please. So we have thorough and successful testing went into determining that these COVID vaccines were safe as other previous vaccines, and that the new coronavirus was so widespread that researchers could easily see that the vaccines provided protection. There were so many people who had coronavirus, who had COVID-19, that they could quickly see with those large numbers of individuals that the vaccine was indeed working. Next slide, please. So the 3 vaccines currently authorized by the FDA include Pfizer and Moderna. They were authorized in January of this year. And then Johnson & Johnson's Janssen Vax, which was authorized early last month. So which vaccine should you get? Currently we do have the pause on the Johnson & Johnson vaccine, but all of the vaccines are 100% effective at preventing death from COVID. And the best vaccine to get is really the one you can get when it's available to you. Getting the vaccine is really your choice, and it's a good thing to address any concerns and questions you have. So that's one of the reasons we have these sessions, is to help people get the information they need to make those informed decisions. So let's take a look at some of the reasons people would decide to take the COVID vaccine. First one, lots of good reasons. One of them being, if we do get vaccinated, it'll help keep your family and your community healthy and safe. Eventually, will get us to a point where we don't need to wear masks all the time anymore. We'll be able to attend those social gatherings, the weddings, the parties, and other events with people we know and love. Getting the vaccine might offer natural immunity, or will offer longer immunity than we might get just getting COVID. And it's a safer way getting the vaccine to build immunity, as opposed to risking getting the actual virus and potentially being hospitalized and getting a severe case. And the vaccine helps prevent you from getting that severe case and possibly dying from COVID. One of the things researchers are starting to see is that people who have had COVID may have some severe long-term health effects, and that's being studied right now. So that's another reason you may want to consider getting the vaccine, is to avoid getting COVID and then dealing with some of these long-term health issues that are becoming more apparent. So if you get vaccinated, you may feel some relief, and because you'll be getting the best protection we have at the time from COVID. You feel like a weight's off your shoulders. It's safe. FDA, CDC, and a New York State Independent Advisory Task Force approved all 3 vaccines after careful review and testing. And you look at the numbers of people who participated in all 3 clinical trials, we are at over more than 115,000 people who had the vaccines and helped determine that they were safe. Now, when you do get the vaccine, you are going to have a response, an immune response from getting the vaccine. And that's normal. That's your body's doing what it's supposed to do to develop the antibodies to fight the virus. And this is just, again, the vaccine is working, and your immune system is doing the job it's supposed to do after being prompted by the vaccine. So some of the side effects you might experience include pain at the injection site. There may be some fatigue, headache, body ache, chills. Nearly all those side effects will occur within a day or so of having the vaccine, but they'll also be gone within a day or so of having those symptoms. The vaccine costs nothing. There's no cost to you. There may be a fee for getting the vaccine, but your insurance will cover that. And if you don't have insurance, don't worry, you still don't have to pay. There's no cost, even with no insurance. Once enough people get the vaccine, it will allow all of us to live life to the fullest. Now, there are undergoing efforts right now to ensure that the vaccine's distributed equitably. And there's a website, this flvaccinehub.org. You can click on here, when am I eligible? And it can tell you when you can expect to, who's eligible to receive the vaccine. And then also, next slide, please, will help you schedule your vaccination. Currently, the vaccine's available to anyone 16 and older, but this tool can help you schedule, find locations and sites that are administering the vaccine. This tool, Am I Eligible? It's available in English, Spanish, and a number of other languages. So it is available to the general population, may not just be normal English, natural English speakers. And it's important to note, next slide, please, that COVID-19 has affected Blacks and Latinos at much higher rates, harder than other groups. In fact, Blacks and Latinos are twice as likely to die from COVID-19. What's important to remember is that this is something that Blacks and Latinos also played a key role in developing the vaccine that's helping protect individuals. Dr. Kizzmekia Corbett here led the work at Moderna. And locally, we have Dr. Angela Branch, who is a Black doctor and scientist, also engaged in research on the COVID vaccines. And once the pandemic started, we had local Black and Latino providers organizing testing and outreach events to help slow the spread of COVID and working in the community. So as we continue with the vaccine distribution, remember, even after getting vaccinated, wear your masks to cover your nose and mouth, physically distant to stay 6 feet apart or more, wash your hands often and thoroughly, and if you feel sick, stay at home. If you need help finding a clinic or a site, or you have any generic, general COVID questions, you can dial 211. And you can also visit this website, 211lifeline.org, to connect you with additional resources. So there's the end of that. Now we can open it up for any questions.
Just one point, and Kathy, you did a beautiful job. And I was thinking, thank goodness she's really familiar with this deck. You may, remember when you're in presentation mode, you can't see the notes.
Right.
So if you may want to print out, some of the key, pages that you want to remember. I don't know if you're really super sophisticated and have, another computer open. But just, making sure, because especially it takes a while to get comfortable with the deck. And then you're changing it every time you go out if you have a different, population that you're serving. So I did not mention that. And I think, Kathy showed that she really knows the deck, and it's very helpful. So there are questions in the chat.
I have a question.
Okay.
Maybe I should do this. Should I have video? I'm real. Hello.
Hey there.
How you doing? I do have a question. Excellent presentation, by the way. Thank you. Actually, my question was related to the length of the presentation. Like, what time frame would you consider to be the best sort of length in terms of like actually giving a presentation to make sure that A, we're getting the most information across to our audience, and B, that it's like in the most effective sort of way possible?
No, that's a great question. I know we, most of the time people invite us for about an hour. I did one yesterday that was a half hour. So I tried to do, Kathy length presentation, like a 10-minute presentation, so that we could spend the rest of the time on questions and answers. In general, I usually do a minute per slide of content. So you saw there were a lot of divider slides in there, so I don't count those, but I usually try to give myself about a minute a slide, but I think probably I talk as fast as Kathy. So a lot of these you could probably do in less than that, 30 seconds or even 15 seconds for some of the slides. So, so for our presentation, maybe a little longer, 20, 30 minutes worth. And I think the people, what I'm finding, people just really want to ask their questions.
Yeah.
So, yeah.
I guess the second part is in terms of sort of subjectivity. So as in like, trying to make it more personable and like letting people know like your experience or, maybe some questions that you personally had, like, should that be something that you include within the presentation, or is that something that you should leave kind of like for the Q&A?
I mean, you gotta feel that out. Oftentimes I will throw some personal stuff in there. I'll say, I'm not gonna lie, that shot really it hurt my arm. But it really is your comfort level. And I gotta tell you that some people are gonna try to get very personal. So I try to steer them away from that, personal situations. And I usually say, you really need to talk to your doctor about that. People say, well, I'm on insulin. And I'm like, that's something you should really, discuss with your doctor to try to limit the amount of personal health information that is shared. Did that answer your question?
It did. Thank you so much. I appreciate it. I'm writing notes at the same time, so I'm just make sure I appreciate it. Thank you.
Like when I talk about the hand washing, I tell them, I always insisted my kids wash their hands when they came in. So it's just a little, real life story to associate to the hand washing.
And I think as you do the presentation more, you'll feel more comfortable inserting appropriate things in. Amy was saying she loves it when she, people weave in storytelling. That's because she's a communication specialist. So she likes that. But I think you'll find it naturally. I was thinking about the hand washing thing. I know when I first started doing presentations, I had to admit that 20 seconds was long. And I found that, okay, if I'm doing 10 seconds, I'll also do the sanitizer, so I try to keep it real, because we're all human. And the other thing I'm never afraid to say is, I'm not sure, and I'll check it out. And I think, as a physician, maybe it's a little easier to do. People who are lay folks may feel like you're not adequate or don't know enough. And I think, go ahead and say, look, I'll check it out and we'll get back to you. Because I've been stumped a few times, and sometimes your partner can help. One of the people I present with, she's like so fast on up to date or Google or whatever, checking stuff out if she sees I've got a puzzled look on my face. So, but really, I think it's okay, and I think people respect the fact that you're honest and say you don't know. Yeah, you're right, Dr. Dundas. I don't know if you want to speak out loud, but people do relate to stories. Some of the people do relate to data, especially some of the we do have a couple of graphs that are pretty dramatic, for people who like that picture. But I definitely agree.
Yeah, absolutely. I just wanted to point that out, especially with J&J right now, when people are looking at like the 6 out of a million, people still aren't grasping that. And that's totally understandable, because a lot of us as clinicians, we see data, we appreciate data, we live, breathe, and sleep data. And just from other media stuff too, I've just really learned and been taught that storytelling just really helps us connect with the community, and kind of just gets rid of that barrier in terms of our white coats versus the community at large. So just to be cognizant of that.
No, good points. Excellent. Can you repeat who should do the presentations and how many instructors? So I've done with 1 and as many as 3. And I got to tell you, 3 was a bit awkward. So I suggest 2 seems to be great. It's nice to have a buddy, a partner. And certainly if you're not comfortable presenting by yourself, let Sue know. But mostly we try to do it in pairs. And it's just more fun, I think. Oh, I'm sorry. Somebody's had their hand up and I can't see who. Oh, okay. Hi, there you are.
Hi, I'm Desiree Branson from St. John Fisher College. How are you doing this evening?
Fine, thanks.
Just a little on what we were just speaking about. If we have someone that asks a question that we can't answer it during our presentation time, do you want us to collect that aggregate information, send it to Common Ground so that we send out the information back to the group from one central area, and then those slide decks can be maybe updated based on those questions?
No, that is very helpful. And as a matter of fact, the presentation where we had a whole list of questions that were close to stumping us. I don't think they quite did, but they were interesting questions. And it was interesting because it wasn't a group of, actually there were community health workers. So they were used to going out and getting these questions. So they were I thought real important questions to hear. And what did we do with those, Amy? We took them and we plan to incorporate them in probably some
In the new
slides.
deck.
And
Yeah.
So, no, absolutely. Thank you. And also we can do the homework too. If you just leave us the questions and we can circle back around to the requester. The other thing that Sue can do is to send a sample presentation to people who's like, oh, what the slides? We can send them a representative PDF so that they can share, and they can always, see it on our website too. So.
I had a second question. Do you have a Common Ground Health background that you'd like to use that you could send to us?
We are working on a digital background, but I think that brings up, if we rebrand the deck, we may give a general background that fits with the new brand, and we'll be making those decisions very soon.
Okay, great.
Yeah,
Thank you.
They won't let me choose because I've chosen some very artful backgrounds that I thought were fine, but I was told they're a little loud. So,
Thank you.
thanks. Anything else? Anyone else? Wow, we did well. We have 8 minutes to spare, and I don't know if it's because Kathy talks so fast or that you guys are really experienced presenters and have already gone out and done this presentation.
Hello, hi. I'm
Hi.
sorry, I have a question.
Yeah.
This is Dean Seneca.
Hi.
So, oh, there I am. So how does this work? Do questions come to the organization and then you filter that to speakers, or, how does it work within the organization?
Rarely do we get a set of questions, but when people request a speaker, they may have different topics that they want us to address. And I think people usually just pick everything, like, basics about COVID. But if it's a group who, we already know the basics about COVID, we just want to know about, the vaccine and its side effects. So we give the requesters a chance to let us know what they would like us to focus on. And Sue will in turn tell us when we go out to speak, hey, and she also talked about the demographics of the group. This is an all women's group. They wanted a Asian American woman to speak. And here are the concerns, so they, it can get pretty specific. And so we try really hard and I should be quiet and let Sue talk, but we've been really trying to encourage people to sign on to our speakers bureau so that we have, some variety to offer some diversity to offer our requesters.
Great, thanks.
Thank you.
The question
Amy's
came
still
up
putting
about the
information.
Johnson & Johnson situation, and since it's evolving, you may be getting this. So I just wanted to share some stats about that. 20% of people who have COVID get blood clots, and so that's a rate of 1 in 5. 1 in 500,000 is your likelihood of getting struck by lightning, and 1 in a million is the current estimated rate of those blood clots that could be linked to the Johnson & Johnson vaccine. So we're going to keep watching this, and we will update the deck, and I'm going to include that in the deck.
Excellent.
Some other questions that come up are about pregnant women. Our original deck didn't have the new studies came out since the version of the deck that's on the website, saying that there's some protective effects of the vaccine in pregnancy.
Mm-hmm.
So,
Okay.
oh, go ahead.
Yeah.
And
Dr. Beckman?
you want us to keep away from making comments about what individuals should be doing, so that their personal decision making is not something we should be stepping on or into.
Yes, we want to give people the facts so they can make their own decision. And that has been tested as the best strategy to help people. And a lot of times you'll see people, maybe they start out the presentation being very hesitant, but once they hear the facts just presented very neutrally, it helps them to see that there's not as much to be scared of with the vaccine. It still is a personal decision anytime you put anything in your body. And we definitely respect that and want people to just be able to know. And maybe they won't make that decision for themselves today, but maybe they'll wait a couple months and then make that decision. We don't know. So we just want to be there as a resource for when they're ready to make a decision.
Yeah, I almost always include that slide that, Kathy mentioned, it's your decision. And it's okay to have questions. So good point, Dr. Beckman, changing your name. Mr. Seneca, you had a question?
Yeah, I missed that? Did you say 1 in 5 people get blood clots who have COVID-19?
Yes,
Oh,
it's about 20%.
yeah. Yeah. Please share that.
Yeah.
I thought I heard something like that today, but I didn't know it was that statistic. I mean, that's huge.
Yeah.
Thank you.
And that is a bit much. So I will just double check on that. And it may be people who are hospitalized, for instance, or with a more severe case. So I will just definitely double check on that.
That's true. I think
Yeah.
I saw a whole bunch of numbers. I was looking at studies today about it, and it is hospitalized and some ICU, but they range. It even goes up to, if you're in the ICU, your rate is about 40%. So it's very high.
Yeah, that's true. Okay, well, this is great. I appreciate all of you. And like Amy said earlier, we thank you for volunteering to do this. This is such a huge lift for our community. And we can definitely tell the love and respect that you all have for the community. So anything you need.
Dr. Clark, could I ask a quick question? I'm sorry.
You're missing,
I tried to raise hand
up my
feature.
whole, like, all right, Terry
I'm
Bales.
sorry. I was just curious because I sort of anticipate that a lot of people that have volunteered to be speakers are probably people who are already leaders in different ways in their different communities and might be asked to talk about the vaccine informally. And so is the preference that we, if that happens to any of the volunteer speakers, that they point people to submit a formal request through the Common Ground Health website, or is it okay for people to just use the resources that you've made available and ask similar questions to what's in the requester form to kind of tailor their presentation?
Thanks for asking that. So I see Sue like, we really would like to keep track of you know, who's getting educated and how they're getting educated. You know, obviously we're not the, you know, we're not going to be the Common Ground police, but it was very helpful for us to know. So, you know, when Jackie was talking earlier about those informal table talk discussions, we may not be involved with matching them up at all, but we always make sure that Sue knows and that we can just keep track of the work we're doing that's coming out of the Speakers Bureau and the mileage we're getting out of Amy with the deck. So thank you.
And it's
That is fair.
say to Dr. Clark, it's also just good to know the demographics and the people that we're reaching. So, you know, even just sending that information to Sue is a good idea as well.
Sure. And if you know it. Another thing is we're happy to send the evaluations to that group as well. That will help us determine some of that. So, okay. All right, so now it really is 7 o'clock. Y'all just wanted to hang out. So that is good. Thank you so much. Have a pleasant night. And thank you again for all you're doing.
Thank you, Linda.
Thank you. Great presentation.